Hi, thanks for joining me today. My name is Kimberly Lynch, and I'm here to do a little quick Zoom for you and tell you a little bit about InLight Therapy, a company that has just fantastic and amazing light units that allow the body to begin to heal itself. So I'll talk to you a little bit about why light therapy is important to us. I'll show you a few quick videos, and then we'll wrap it up with looking at the units and giving you some good information on who to get in contact with if you'd like to learn more about these units. So I like to always start with a quote by Dr. Michael Hamblin from Harvard Medical School. And he says, "The day may not be far off when most homes will have a light source, most likely an LED device, to be used for aches, pains, cuts, bruises, joints, and which can also be applied to the hair and even transcranially to the brain." And I like to start out with this because it really gives us an idea on the fact that we need to check into light therapy and find out some of the ways that it can really help out in our daily lives. So the company is InLight, and they were established in 1985. There's a class 2 FDA cleared medical device to decrease pain and increase circulation. And they use a multi-pulse technology, and the systems are sold through authorized representatives. And the reason they do that is they want to make sure that you have the personal touch that you need, and we can really work with you and make sure that we get you the information that you want to make the decision on how light therapy fits into your life. So let's talk a little bit about how people are feeling today. I was noticing in my family, my friends, my practice, a lot of people are experiencing anxiety, stress, depression, pain, not sleeping well, and these are just a few of the things that we really need to find a better way to deal with and give ourselves a natural way to allow our bodies to heal themselves. So, like I said, my name's Kimberly Lynch, and I'm a stress management specialist. I'm a naturopathic practitioner. I work with quantum biofeedback and also these LED lights. And my story is both personal and professional because I first found the lights about 12 years ago. And the way that I found them was a dear friend of mine introduced me to them because she thought they might help my back pain. And I had actually had a car accident in my early 20s and hit my face on the steering wheel and had my jaws wired shut and had had so much pain in my jaw for years and tingling, and I had no feeling of sensation on my skin in my lower jaw. And I kind of had just become used to that. And so when I put these lights on my back for my lower back pain, I started getting all this sensation in my face back. And it was really surprising to me because I had gotten to a point where I had just gotten used to that was kind of how I felt. My jaw always hurt, and I kind of had forgotten about it. It's just always how I am. And so I used the lights a few times and got the feeling back in my face. My jaw straightened out. I could chew properly, and it was just nothing short of a miracle for me. So I thought, hey, I love these. My family used them. They loved them. And I knew that it would be a great idea to share with the world. So I started to incorporate them in my daily practice too. And my clients absolutely love them and just have incredible stories to tell. So let's talk about whose responsibility it is to look out for your health. And the answer is yours. So we really need to take that extra step. And if we're not getting to the bottom of issues we have, really, let's look into it and let's keep looking until we find the answer. And that's really how we've ended up here. So we want to talk about what is photobiomodulation and LED light therapy. So it works through light emitting diodes, which are LEDs, and they produce visible and infrared light waves. They're applied directly to the skin, and they stimulate a variety of responses. And the FDA, again, has cleared our light system for reducing pain and increasing circulation. So there's actually over 7,000 studies on PubMed that have to do with these topics because it may be new to some of you and it kind of sounds too good to be true, light therapy and how it works. So I encourage you, if you're interested, to really dig into some of those articles and see what you can find out. So here's a little quick video that gives us an explanation of some of these terms and how they apply to our bodies.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. The muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near infrared light penetrates about 20 to 100 millimeters. Near infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level. These are generalizations because the more red cells with hemoglobin in the path of the photons, the shallower the depth of the penetration. Remember, hemoglobin absorbs the near infrared light energy, thereby releasing nitric oxide. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following: improved sensation, which offers better gait and balance when walking; reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities; increased oxygenation, which acts to reduce inflammation; and finally, increased circulation, which offers the body decreased wound incidences and shorter healing times.
So that's some good information. If you're new to light therapy and kind of how it works, that gives you a really good idea on what light therapy is and how it helps our bodies. And they say it so much better than I do. So I'll show you some more slides and also another video, and then we'll wrap things up. So again, to recap, what does light therapy do for us? Well, it releases the miracle molecule, nitric oxide. It increases ATP production. And what's important there for me is the energy levels in the body. It increases circulation, which is really important because really our cells need oxygen to work properly. So to take the conversation on circulation a little bit deeper, here's an excellent video to give us a little more light on the subject.
In a young, healthy person, they have good blood flow, good circulation. There's no plaque built up. The arteries are flexible and pliable, not rigid or stiff. The heart functions normally. But as people age, nitric oxide production decreases, and the consequences are severe. Arteries become stiffer, more narrow, constricted, and plaque builds up. Circulation and blood flow decreases, limiting oxygen and nutrient delivery to every cell in the body. Blood pressure and fatigue increase. Sexual function decreases. Normal stem cell functions are lost. Inflammation increases. Cognition and memory decreases, increasing the risk of Alzheimer's. Basically, every function in the body works less efficiently. But technology exists to reverse these effects, to restore and repair normal nitric oxide production, and provide the best outcome as you age. By choosing to restore nitric oxide production, arteries become healthier, plaque in the lining of the blood vessel is removed, your circulation improves, heart function improves, blood pressure normalizes, sexual function improves, normal stem cell functions are restored, cognitive abilities improve, everything works better.
So that's a great video that kind of recaps for us why circulation is important in our bodies. So who uses light therapy? Well, everyday people do, from using it at home, professional athletes, health clubs, all sorts of people use light therapy, people of all ages, and you can see even animals, we use light therapy on our animals. They respond extremely well, just like humans do. There are a lot of professionals that use light therapy, as you can see listed here. Again, it fits very nicely in our Western medical model. By increasing circulation, our doctors understand that that's an important thing for us to have, and it's especially nice with those FDA clearances to increase circulation and reduce pain. And, to the naturopathic practitioners and everybody in between. What is it good for? Well, pain is because of inflammation. And so anything that ends in an itis, like bursitis, tendonitis, plantar fasciitis, all the itises mean that you have inflammation in your body. So as you can see on this list here, reducing inflammation really helps with things from headaches to fibromyalgia and a lot of the autoimmune disorders as well. So just some more of a little deep dive into inflammation and what it can be used for and the studies that are out there on PubMed and through Harvard Medical School. They talk about arthritis. Wound healing is talked about in a study from the University of Wisconsin. Again, the lights are great for different things, neck, shoulder, back pain. We'll just flip through a couple of these real quick. Bone health, general wellness, the neuropathic pain that people suffer a lot of times when they have diabetes. Chronic inflammation, again, tie into simple situations as well as some of the autoimmune processes in the body. Joint pain. Again, a few more things that it really helps with. You can kind of just look through that list there, but really anything that has to do with inflammation and pain. We'll dig a little deeper now into the fibromyalgia because that is really kind of transient pain throughout the body that there's not a real good explanation for, and a lot of people really suffer with that. Another big thing is depression. We're seeing that a lot lately, especially in today's world with all the stressors that are going on or causing people to experience things that they haven't experienced in the past. And we really need to look at the brain and the effects on decreased circulation in the brain. And whether it is from a traumatic brain injury or if it's just from a neurological disorder, the light therapy really helps. So we'll look a little bit more about, learn a little bit about the traumatic brain injury. You can see here's a picture of sports, a sporting event, and as we know, we're always hitting our heads, and especially if you have a car accident or a concussion or something like that, there's not a lot of things in our current model to help the blood flow for the traumatic brain injury. So what brain disorders are treated well by the device that we have? And it can be anything, Alzheimer's, dementia, ADD, Parkinson's, insomnia, stroke. And these are very severe, some of these, but really just the traumatic brain injury itself, just when you conk your head, it doesn't really matter if, you're diagnosed with a concussion or not. That is a brain injury. And PTSD, of course, these are all disorders that are helped through circulation. So here's another little video to deep dive a little bit more into that.
Traumatic brain injury or concussion may occur in a variety of situations, from simple daily accidents to head injuries suffered in automobile collisions, to trauma experienced by military personnel caused by battlefield explosions, even severe head impact suffered by participants in sporting events at the amateur as well as elite athletic levels.
I think after 20 years, God only knows the toll. This was a little shocking to me that I couldn't remember my daughter playing youth soccer. It was just one summer, I think.
Traumatic brain injury, or TBI, can often lead to chronic issues with memory, unexplained anger, antisocial behavior, along with disturbed sleep patterns. Previously, prescription drugs along with behavioral therapy provided limited and unpredictable results for those living with TBI. These therapies have been the only course of treatment for TBI up until recently. Currently, injured areas of the brain can be localized with SPECT scans and qualified for severity. SarahScan, a specialized imaging technology developer, documents changes by comparing a combination of before, after, and normative images. The resulting images document regions of low blood flow. On these images, the gray areas represent good to normal blood flow, while the green and blue colored areas are not receiving good levels of blood flow. Near-infrared light therapy is FDA cleared for increasing circulation. Near-infrared light penetrates the bony skull and can reach areas deep in the brain that are underperfused. Research conducted by Dr. Michael Hamblin, principal investigator at the Wellman Center for Photomedicine at Mass General Hospital and associate professor at Harvard Medical School, suggests the fact that near-infrared light can penetrate into the brain would allow non-invasive treatment to be carried out with a low likelihood of adverse treatment-related side effects. Furthermore, low-level light therapy may have beneficial effects in the acute treatment of brain damage injury by increasing respiration in the mitochondria, causing activation of transcription factors, reducing key inflammatory mediators, and inhibiting apoptosis. Near-infrared light is well studied and is known to cause the release of nitric oxide from red blood cell hemoglobin and thus is a powerful vasodilator.
In 1998, the Nobel Prize was awarded to 3 U.S. scientists collectively for their discovery of nitric oxide. So now we know it's the main molecule produced by the cells that line every centimeter and inch of blood vessels. It maintains normal blood pressure. It's a molecule produced by our white blood cells that helps fight off invading bacteria and viruses and even kills off rapidly dividing cancer cells. And it's a neurotransmitter in the central nervous system. So it's basically involved in every biological system within the body.
The application of near-infrared light directly to the skull of a TBI subject will increase blood flow, but nitric oxide also causes angiogenesis, which is the growth of new blood vessels at the injured brain area site.
Angiogenesis is a process that occurs naturally. When you have a wound, you heal that wound, it requires new blood vessels to grow into that area to supply the new tissue with blood.
I've been impressed by looking at the SarahScan imaging technology that SarahScan has provided, which shows, I think, the chronic nature of sustained injuries within the brain 6 months, a year, 5 years after that injury had occurred. The beauty of what these first two warfighters and the treatments that we've instituted in them with near-infrared light therapy has shown is that even though the injury happened several years ago, within 12 weeks, major changes in blood flow within the brain are documentable. And associated with this are improved sleeping habits, better memory, less social disruption. There are a lot of positive things that I can't believe haven't been the result of better blood flow.
SaraScan images have shown a restoration of blood flow in the brain to near normal levels following 18 to 24 treatments over a 6 to 12 week period, using near-infrared light exclusively. This protocol has proven sufficient to restore blood flow to near normal levels in an injured brain, regardless of the time elapsed between injury and treatment. This increase is generally accompanied by a reversal of the TBI symptoms. With a positive increase in blood flow, physician drug recommendations may actually become more effective, as increased blood flow can help deliver drugs to damaged areas of the brain.
Isn't this so exciting that we have something that we can use for traumatic brain injury? Because traditionally we don't. And some of you may be familiar with Dr. Daniel Amen, and he does a wonderful TED Talk. He uses the SaraScan technology and talks about how you can have Alzheimer's 30 to 50 years before you have symptoms. And I'm happy to get you a copy of that TED Talk if you'd like, but it's very interesting. And hey, that's now. And that's if without traumatic brain injuries that are happening. And so this really gives us a great tool to help to use with some of these things that we just haven't had a tool for before. So let's look at you taking control of your health. The technology is amazing. The pads are easy to use. You can use it on yourself, your family, your dogs, your neighbors, really anybody. And when you start having great results with it, that's kind of what happens. People come out of the woodwork. So let's discover together what InLight system is right for you. So I'll give you a little bit of overview on the system, and then you can go ahead and connect back with the person that shared this video with you. And we can get you all the information you need from there. So InLight offers several system packages. There is a big 6-port controller, and that means it'll hold 6 pads, which is awesome. The settings run in 20 minutes each, and so if you are doing 6 pads at one time, you can really cover a lot of area. There's also, you can see next to it, a little travel controller with 2 ports. And so there's different systems here, the 6-port systems, some of the different 2-port systems. And again, the person that shared this with you will happily go over these options with you and see what's really best for you. For people with the neuropathy pain, diabetic, there's boot pads here. The T-pads fit great over your lower spine and up your back, or over your shoulders and up your neck. So again, so many different options to really get you exactly what you need. You can see here's a little price list, and again, that can be shared with you, and you can go over that with the person. So go ahead and connect with your authorized representative that gave you access to this video today. And if you cannot remember who it is or need help finding them, please feel free to contact me. Again, my name's Kimberly Lynch, and my best contact is through my email, naturalbalancetoday@gmail.com. Thank you so much for taking this time to spend with me today and get a little bit of an overview on the light systems and what benefits to your health this technology has to offer. So I encourage you to really think about how this would enhance your lives. And when you're ready, go ahead and get in touch with us today. Thanks so much. Have an amazing day. Bye-bye.